AMALFI was a trial looking at AF screening to see whether we can diagnose more AF using an ECG patch that's worn continuously for 14 days compared to usual care. We recruited individuals from UK primary care, and this was done without requiring any physical or virtual participant visits. Individuals were identified through their healthcare records, and a letter was sent inviting them to participate. Individuals who responded positively were then randomised, with half being sent the ECG patch and half being allocated to usual care. The primary outcome was the diagnosis of AF at 2.5 years in their GP records. The trial showed that the patch strategy was successful. There was more AF diagnosed with the patch compared to usual care. It was diagnosed earlier, and it led to more exposure to oral anticoagulants. However, the rate of AF diagnosis unrelated to the patch in both the patch and the usual care arms was greater than anticipated. And this meant that the difference between the two arms in the rate of AF diagnosis was closer at 2.5 years than we had originally anticipated. We are now undertaking further analyses, including long-term analyses and cost-effectiveness analyses, to find out whether this strategy could prevent stroke and whether it's cost-effective, to determine whether it should be used as part of a national screening strategy. That's a great question, and when we designed the trial, that was exactly what we had in mind. We wanted to see whether we could use a strategy that's highly scalable, that could be used in part of a national screening strategy in future. So we wanted to make sure it was low cost and it involved very minimal burden to participants and to healthcare professionals. So the identification and invitation was all done by post. The results the patch was returned to the manufacturer, who analysed it, and only the key findings were shared with the usual care practitioner to avoid overloading them with information. We gave them information about whether AF was present, the burden, and the heart rate in AF, as well as any other important incidental findings such as sustained ventricular tachycardia or high-grade AV block, but didn't provide them with a detailed report. And we showed that this approach was successful in that primary care physicians did anticoagulate individuals in whom AF was found on the patch, similarly to how they anticoagulated individuals where AF was diagnosed through other methods.